Good afternoon. Welcome to another session of My First Job, the podcast. We've had 46 sessions so far, and today will be episode number 47. My name is Venugopal, and I'm the CEO of a company called Ideascape. Every week, we talk to people in different professions and we understand what their career journeys are about. And even when people are in the same profession, their career arc and the way they arrive at what they're doing can be quite different. Today, we have the pleasure of talking to Dr. Kaushik Ramakrishnan, who's a dental surgeon. He started off in dentistry, but he has a much bigger goal in mind. He wants to ensure that oral care in the country is taken to a whole new level. And he started his not for profit venture called the Total Oro Foundation. Let's talk to Dr. Kaushik and figure out what his journey is like. Good afternoon, Dr. Kaushik.
Good
Pleasure
afternoon,
to
sir.
have you on the show.
Thank you. Thank you so much. Thank you for having me.
Okay, so do you remember the first patient that you examined when you had to get into your practical part of, you know, getting past your course? Do you remember what it was like?
Yeah, I do. The first posting I was in was the Department of Oral and Maxillofacial Surgery when I
Okay,
just got into my clinical years. And so basically, they teach you how to extract teeth. And
okay,
so you get a patient, and the easiest tooth to extract is the front teeth. So, front set of teeth. We call it the anteriors. And the first patient I got was, the first patient I had to clinically perform a procedure was an extraction, and yeah, that was quite fascinating and frightening at the same time. You're muted, sir. I think you're muted.
yeah, I'm muted. I'm just fixing that. Is that okay?
Yeah, much better.
Yeah. Okay. So, I mean, all of us traverse different paths, but what is your route to coming to dentistry? Where did you begin? What were your early influences like?
To be totally honest with you, my dentist, my childhood dentist was one of he was, I wouldn't call him he influenced me in a certain way. He something about the teeth was fascinating, and when I started reading about dentistry per se, something about it was quite fascinating. And honestly, I was honest. With all honesty, I'll have to tell you that I wanted to get into medicine, and dentistry was my second option. And I thought, okay, fine, let
Okay,
me take it up. And I'm pretty sure that most of the dentists who are studying right now, most of them had option of medicine as the first choice and dentistry was the second choice. And
right.
I got into dentistry, and once I got into dentistry, I started loving the subject. It was really fascinating.
Okay.
Yeah.
So, what were the some of the early experiences in college? I mean, obviously, you have to be scoring pretty good marks in order to get to even choose either dentistry or this thing. I spoke to a veterinarian a few weeks ago, and he said the
Okay.
same thing that he first wanted to be a doc, but then veterinary science is what he got into, and he loves what he's doing. So that sometimes is you arrive at what you like sometimes because you get into a
You
certain
don't know where
stream, and
life
then you realize things you never knew before.
you never know where life takes you. You
Yeah.
choose and you aspire to do something, and then all of a sudden
Okay.
you get some other option and some other choice. And
Okay.
I think
Okay.
it happens for it happens for the good of our thing. Like it is quite
Right.
tough. You never know what you're going to get into.
Right. But
Yeah.
uh, how did this whole thing about working with total oral care come into being? Because it's not as if you've spent a whole lot of time in the in the profession, but I think you've already kind of decided that this is going to be one of the things that you are putting in a lot of effort on.
Yeah, so we started Total OroCare Foundation in the year 2019. In fact, it was me and like another friend of mine. Both of us, we used to just sit and discuss about the possibilities of how we can take dentistry to the next level of, or to be totally frank with you, the amount of awareness about dentistry is definitely improved in India, but there are a lot of aspects of or there are a lot of locations in India where people still don't use a toothbrush on a toothpaste. I mean, that's what
Okay.
study says. People, they don't use; they still stick to using ashes or neem sticks or whatever. So when we were discussing about this, we learn a lot about the importance of maintaining good oral health and maintaining general health, the correlation between oral health and general health, so on and so forth in college. And we also focus a lot on prevention of diseases in college. I mean, the first thing that we learn is how to prevent a particular disease. And we in India, people don't go to a dentist unless and until they have a tooth pain. They don't, unless and until it disturbs their day-to-day routine. They don't go to a dentist. And
Yeah.
when they come to a dentist with a tooth pain, we have only two options: either to do a root canal or pull the tooth out. We don't have, I mean, we don't have a lot of wiggle room there, and both
Okay.
are expensive affairs. I mean, for a middle class person, shelling out about say 8 to 10,000 rupees on a root canal is definitely going to be an expensive affair. So we thought, okay, well, how can we go about creating this awareness? And that's when
Okay.
uh, we looked into how people have done this in the past, how they were able to break barriers and go and spread awareness about anything for that matter. I mean, how they
Right.
were able to, you can take
Right.
examples of institutions like Shankar Nethralaya, which had completely democratized how
Revolutionized. Yeah.
eye care was being,
Right.
a lot of. I mean, they've done phenomenal amount of work. So
Yeah.
when we thought that when we saw what had actually happened, and we thought, okay, fine, why not we start an organization which focuses solely on promoting preventive dentistry. So that is
Okay.
something
Okay.
which we initially
That's how
wanted to
this came
start.
into being.
Yeah, that is how
Okay.
we started Total OroCare Foundation.
Can I ask you a trick question? Now, in the sense that human beings are the only ones who really look after their teeth.
Hmm.
Now, if you look at animals, if you look at a whole lot of things, the kind of food that is eaten, and there is zero oral care. So, what is it that nature does to ensure that, you know, there's a whole, all the species, we are the only people who have to? Is it that our teeth are inherently weak, or is it that we don't have protective mechanisms in place because of
No,
the kind of food we eat? What?
we have a lot of protective mechanisms. In fact, our saliva is one of the biggest protective mechanisms for our teeth
Okay.
and oral health. But I mean, I can attribute this to a lot of our food habits, our the way our lifestyle and everything. That is one part of it, and of course, animals do have their own. I mean, I exactly don't know the cleansing mechanism, but then I don't want to comment on things which I don't know. But then I am sure that there are veterinary dentists. I mean,
Issues.
I know there are people who take care of. I mean,
Yeah.
animal dental health as well. I mean, I'm pretty sure
Right.
I've come across a few people.
Right.
They do
Okay.
extractions. They
So
in fact even do root canals for dogs.
yeah, they, they could be. I know it's just one of those things that occurred to me in passing, saying that. So, how would you define oral health? It's one thing. Is it brush 3 times a day? Is it brush after every meal? Is it brush lightly? Brush, pressing down on your teeth? What are the broad rules of good oral health?
Okay. So brush twice a day, morning and
Okay.
night. Morning after you wake up, brush. After, so the way we brush matters. So there is a technique called modified Bass technique of toothbrushing.
Okay.
So which is the way we are supposed to brush our teeth. And usually, if we follow the modified Bass technique of toothbrushing, it takes approximately 2 minutes to brush all your teeth. So that's pretty much enough. And after we brush, uh, I recommend not to rinse for about 30 minutes. Just allow it, just get the foam off everything, and then don't rinse for about 30 minutes, because the fluoride content, which is available in our toothpaste, it acts on the tooth and it remineralizes it. So that's
Okay.
quite important. And post that, you go about rinsing your mouth, and you can have your coffee or your water or anything. And again,
All right.
before you go to bed, it's vital that everybody, they should brush their teeth. And flossing is equally important. I mean, for flossing, I mean, our brushes are not designed in a way that it goes between the teeth and cleans. So
Right.
the tooth has got five surfaces on the. I mean, when you just look at it, it has got five surfaces. So when you brush, you only brush three surfaces. Between the teeth, you need a floss. You need a floss to make sure that it's being taken
Right.
care of. I mean, to
But
maintain
even
good.
that, I think, all like you said, there isn't even an awareness of using toothbrushes regularly, or we've done everything from brushing with charcoal. I'm, of course, 2 or 3 generations older, so, and I know my father used to, even pick out these neem twigs and then do it. I've had this instance where going to Kerala, you roll up mango leaves and use that as a temporary brush. So all kinds of things were in vogue, and sometimes people say that they swear by it, saying, "This is why I have great teeth." But I know that that is not strictly true. There are so many other things which are, which come in the way of getting your teeth in good shape.
Getting a
Uh,
scaling.
yeah.
Am I audible? Yeah, it's okay. So getting a scaling done once every 6 months. Scaling is
Okay.
basically cleaning of your teeth. So there is something called plaque and calculus that gets
Okay.
accumulated on the tooth surfaces, and getting it removed once every 6 months is very vital to maintaining a good
Okay.
oral health. I mean, you can brushing is vital, and going to your dentist once every 6 months and getting a scaling done is also equally vital.
Okay. Okay.
Yeah.
And when, let's say, before you started, where you went into dentistry, were
Hmm.
you kind of aware of some of these things, or did a lot of things come as a surprise once you joined?
Okay. I didn't honestly. The first thing that came as a surprise was during our orientation program. Okay, we know that adults have 32 teeth, and then the
Yeah.
first time when I'm sitting there and they're talking about the types of surfaces and the shapes of those surfaces. I was like, okay, teeth is
Right.
teeth. So that was the first thought that came to my mind. I mean, why I never knew that there was so much of course, you have to learn. I mean, getting into BDS
Yeah.
is
Yeah.
to learn about our teeth, and that was my initial reaction. I mean, I think I came back home one evening and I told my mom, I never knew that there was so much of detail when it came to how a tooth looks. Hello, yeah, you muted again.
Yeah. So you're talking of understanding, okay, that so much more is involved in not just looking after teeth, but looking into what problems occur with teeth as
Hmm.
well. Now, what is it that sort of got you? Yes, you talked with your friend about the starting of but were you seeing a lot of cases? What was the precursor to getting this to happen?
So basically, when we initially had the discussion about starting a foundation, our core aim or our core vision of the foundation was to promote preventive dentistry. I mean, you go to a dentist, get a scaling done. The maximum cost which a person is going to spend is about say 1,000 to 1,500, depending on the area. And
Okay.
say even if you keep it as 1,500 rupees, 6 months once, if you're going to get a scaling done, and per year you spend roughly about 3,000 rupees, which can be a budgeted expense.
Right.
So it doesn't come as an emergency to a person.
Right.
And otherwise what happens is, and so when a person goes to a dentist once every 6 months, the dentist has an opportunity to see what are all the problems in that particular oral cavity or the mouth. And we can kind of tell the patient or educate the patient about what needs to be done. Say a cost of a filling is roughly about 1,000 rupees. The cost of a good filling is about 1,000 rupees. Whereas if the patient neglects it and allows it to propagate and it touches the pulp, pulp is the tooth is made up of three layers
Right.
or three. It's called enamel, dentin, and the pulp. So pulp is where the nerves and blood vessels and everything is present. And once it touches the pulp, we don't have a choice. The patient will have pain, and we have to either do a root canal or get an extraction done. And both of them are costly affairs because root canal today's rate it's about 8,000, as I said before, and extraction again you extract, you replace, and all those things happen, and so it definitely is going to be a little time consuming
Much more expensive than.
and much more expensive.
Yeah.
And going the
Yeah.
preventive way is what we wanted to do. So initially, so that was our initial vision of the foundation when we started. And slowly, so there was something called, so we have something called GLOBCon data, global cancer data, which rated India as the highest. Okay, so basically, India has the highest number of lip and oral cavity cancer cases in the world. It's probably the
Okay.
second highest now, if I'm not wrong. So we wanted to do something about it, and there was also some another data called Global Youth Tobacco Survey data, where the age of initiation of tobacco had come down. I mean, previously, probably my father's generation, uh, people used to start even when we were. I mean, during my elder brother, or probably about 15 years ago, people used to start using tobacco when they go to college. Let's say 17, 18 used to be the time, roughly,
Tobacco,
where
you're referring to smoking or the chewing tobacco? Both.
anything for that matter,
Okay.
anything. I mean,
Okay.
there are a few places where, by culture, they chew areca nut. Areca nut is
Right.
bakul. So they have culturally they do. They even give it to kids. I mean,
Yeah.
I've read about it, and so the age of initiation of tobacco has come down in India. Like it's people, I mean, children as young as 10 year olds and 11 year olds have started using tobacco, and there are products. I mean, it's they don't have the necessary. They don't know. I still don't. I'm still not able to understand as to why they are doing it. I mean,
Mm.
psychologically, it's a very big question. Is it because of peer pressure, or do they want to look cool? All those. Is it because of some other reason? It's a very big if. But then, looking by the trend, what can happen is right now we are seeing oral cancer probably in the age group of 40, 40s, 45s, 40 and
Okay.
above, roughly. I mean, I'm just taking an average here. And we can, I mean, if the age of initiation comes down, automatically the age of incidence of oral cancer will also come down. And probably in the next 10, 15 years or something, if this trend isn't kept in check, then automatically things can take a turn for the worst. People can develop oral cancer at a much younger age. Hello?
Yeah. You can hear me now?
Yeah. So, and also we
Yeah.
wanted to bring about awareness on it's not just about tobacco. I mean, tobacco is a fraction of why oral cancer is caused. Another issue right now is people. have started stress biting their lips and cheeks. I mean, when they are stressed, they just bite the inside of their cheeks or their lips or tongue. And this we are seeing in a lot of uh, I mean, people who are working in high stress situations. So we are seeing such conditions in those people, and that repeated trauma to a particular area in the mouth can also lead to oral cancer. So that's also quite. We are also focusing on that. So then we expanded our scope from just preventive dentistry to
So how do you? I mean, most people are doing it unconsciously,
exactly.
right? No, the strange part is that people are doing it almost unconsciously. They're not intentionally doing that. It's almost as if they develop the habit because of the stress they're under. So, what is your
Exactly.
advice? How do you tell people get off it because they are not doing it consciously? How do you manage to get them to understand, associate, and then change their behavior?
So there is no one size, fit all kind of a method.
Fits all,
We'll
yeah,
have to try to
right.
understand what's happening with that particular individual in the first place. We'll have to see whether uh, it's stress, or maybe sometimes what happens is the tooth can be a little malaligned. So it
Huh.
can be a little tilted. I mean, we call it buccoverted, meaning on the outside, or it can be aligned in such a way that it causes impingement of cheeks or impingement of tongue. Anything can happen. So it depends on the individual. It depends on what the particular individual
Okay.
is having as his etiology, or etiology as we call it, like as why that particular condition is happening for that particular individual. Yeah. So
Okay.
yeah.
I mean, but this is absolutely. I'll tell you two things which have surprised me about our conversation so far. The first is
Hmm.
that you told me that don't rinse after brushing, which we've been doing
Don't
it.
rinse for half an hour. Don't rinse for half an hour is what I say. I didn't say don't rinse after brushing. Rinse
No,
after some.
yeah, don't rinse for half an hour. Yeah, that is something which I don't know if people are even aware of. Maybe
And don't drink anything also. I mean,
I'm one
don't
of the few who don't know, but to rinse. So you're saying just leave it as it is for about half an hour and then rinse.
half an hour. Don't have anything. Don't drink coffee, water, nothing. So you don't want to drink your
Yeah.
toothpaste. So you basically have to wait for about half an hour for
Okay.
the toothpaste to act on your teeth,
Your
and then the
coffee.
fluoride will
Yeah.
do its work, and post that you can that the same applies to even
Okay.
mouthwashes. I mean, people have this habit of using a mouthwash, especially medicated mouthwashes. They use it and then they just go about drinking their coffee or drinking their tea or drinking water. So it doesn't work that way. You can't just take a pill and I mean, that's a very bad anecdote, of course, but then uh, it doesn't work. You're essentially just washing away all the properties of the toothpaste and hoping that the toothpaste does its work.
Sorry for the technical glitches. I think so. Basically, what you're saying is you're undoing all the good work that you're doing if you rinse immediately, or if you,
Exactly.
then that is the thing. But I
Yeah.
guess at times it's almost like a, what do you say? These things have gone so deep inside you that and people it's almost like a daily routine. You get up, you brush your teeth, rinse, get out what you were doing, and just wait for that cup of coffee, or it's all part of a regular routine. So I think to say that defer it by another 15-20 minutes or at least half an hour is
Half an
something
hour.
that, anyway, it's up to people who have now learnt about this, who know. And the other part which you just told me about stress, biting of lips and the inside of cheeks,
Mm.
and the moment you said it, the relatability is straight
Very
on,
high.
because at times you don't realize you've drawn blood at a point when you're tense or whatever it is. And if you're doing that on a regular basis, then it's okay. But and are you seeing more of this right now because you're having people come in, or that is part of the examination? You notice that people are doing it, or How do you get to diagnose
Now,
these
so basically,
conditions?
when so being a so usually what people perceive is that a dentist equals just looking after the teeth. So there is a lot to do apart from the teeth. I mean, you have the gums and the supporting structures of the tooth, which are taken care by the dentist, of course, and parts of other parts of the oral cavity or the mouth. So we have an opportunity to. So when a patient comes to us, we have an opportunity to examine everything, every single part of their oral cavity. And there are so most of the systemic conditions meaning general conditions, right from vitamin deficiencies to leukemias, everything have got oral manifestations, meaning if a person has got a vitamin K deficiency or a vitamin C deficiency, they are most likely to have bleeding gums. So
Okay.
this is as simple as that. Or if the person has got a very bad poor oral health, I mean, as in if the gums are inflamed from plaque and calculus, then and if the person is diabetic, so there is a correlation between gum health, periodont. I mean, if the person has got very bad gums, and if the person is diabetic, then it can affect the glycemic index. I mean, the person may not be able to bring down his glycemic index. So I'm talking about the HbA1c levels. So the sugar levels may not come down. So there are a lot of conditions. There are, as I said, it's not just the tooth. I mean, the dentist is not just looking at your tooth.
About extraction
Which
tooth,
are-
yeah.
Even now, there are cases where we can support patients with obstructive sleep apnea. So there are people. A lot of people are getting obstructive sleep apnea right now, and there are devices. Even something as simple as wearing braces and expanding the arch can also help. I mean, can also help in certain conditions in making sure that the person doesn't develop obstructive sleep apnea, or if he has developed, he can also kind of get rid of it. It's a very big
Okay.
science.
Yeah, it is. So obviously, it's going to take a lifetime to get past, which is where I think at some point, the person you are today versus the person who joined dental college, do you now look back and then say, hey, it's good that I stumbled into this, or at least I came into this because it has helped open up a world that is just getting wider by the day rather than getting narrow?
Yeah, I mean, yeah, quite happy that I chose dentistry. There were initially times when you kind of feel that okay, when you have a really bad day and you feel like, okay, maybe when you see some of your friends becoming so it's a very slow process. I mean, medicine is
Right,
a very slow process. So it's not like
right.
you just finish your education and stumble upon a good job and move on, and
Yeah,
it doesn't happen that way. So it takes a little bit of
right,
time. You need that little bit of patience and commitment
right,
to make sure
right,
that you're on the right track.
right. Okay, let me come to another part which I think is not greatly explored in terms of milk teeth. Parents
Mhm.
have this thing where the first milk tooth they're very clear about, and when it happens, it's almost like an occasion for, yeah, his, the child's real or the adult teeth are coming in. But do you think it's easy to retain that focus? How do you figure out which is, how do parents track, or how do dentists tell them to track how this entire set of teeth is falling, and is there a normal process?
Yeah, so we have a table which ideally gives us the age at which milk teeth are supposed to start falling, and the permanent teeth starts erupting. So that is readily available on the internet as well. I mean, parents can also have a look at it, and usually we give a 6 month buffer, 6 month to 8 months buffer between I mean, not all it's not something where you say if the milk teeth is supposed to start falling at 6 years.
Yeah,
It's not like on 6 years in one day it falls. It doesn't happen
yeah,
like that.
yeah,
So we
yeah.
usually give about 6 months buffer, and if it doesn't fall by then yeah, we'll have to intervene. And the most important
Okay,
thing is what I see. So, something which the parents should take note of is that the minute their child gets their first tooth is the time. or that particular day is when you go to your dentist and have a checkup done, because a lot of things can be so we have patients, or we have certain conditions in orthodontics. Orthodontics is where you wear your braces and
Right.
clips, and they are called clips, but then braces is what we say. And there are certain conditions. We have something called preventive orthodontics. You would have probably seen these appliances which kids wear in movies, in Hollywood movies,
Right.
where they try to change the way the jaws grow. So if the person has got a retruded jaw, they try to pull it out a bit. And if the person has got a prognathic jaw, they try to push it in a bit. So all those things can be done. So they're called growth modification devices. So those things can be done if you go. I mean, if they take their child to a dentist from a very early age, it's quite possible, and that can make sure that at a later date they don't have any dental or oral discrepancies.
Okay. In terms of practicing the profession, what is it that you have learned in terms of dealing with patients over the past few years? What is your experience of how do you approach patients? How do you understand more of them? How have you expanded your own knowledge?
I mean, how I deal patients is right now everybody's a Google doctor, so they don't. I've seen some of my patients who come and tell me, "Sir, I need a root canal." I'll be like, "Okay, who examined you?" There is no. I mean, the people just come. They give me the treatment plan and they say what. Oh, I mean, all I have to do is execute it. That's how they, sometimes they come to me. And honestly, that doesn't
Okay.
work. They don't give us an opportunity to even talk to them about what is happening. But there are a few set of people who are like that.
Yeah.
And yeah, I mean, most of them are quite understanding, and they give us an opportunity to explain what is happening, I mean, to their mouth. But you have another, I mean, every side has got two. I mean, every coin has got two sides, so definitely that happens.
Yeah. Yeah. Okay. In terms of what do you say? Your own understanding of where dentistry, or what are the steps that you need to take in order to help people understand when you're going into explaining basic things to people. Where do you
Hmm.
begin? Is it at brushing? Is it at giving one set of information where you prioritize and then say, I give you, do this, everything else we look at later?
Brushing and flossing, oral hygiene instructions is the starting point of any oral health measure. So you tell the
Right.
person. I think I had one of my patients who came and told me, if I remember right, I believe in Japan they have tiny booklets which have got
Yeah.
detailed instructions on how to brush and how to
Okay.
maintain their oral health. And he told me about this. I told him, if possible, I mean, if you have ever get an opportunity to get a copy, then I would like to get one, because all those things are supposed to be. So I believe they gift in Japan. They when a baby is born or something, or any occasion, they gift such booklets. So oral
Okay.
hygiene instruction is where we start. Basically, we tell them how to brush, and then when we do a screening, we understand their individual needs better. We know if a person is brushing. So there are instances where people become a little too uh, I mean, harsh on their brushing.
Aggressive.
They become
Yeah.
super excited about their brushing and end up brushing for like. I've had patients who come and tell me, "Sir, I brush for 10 minutes every morning, half an hour every morning." And that, I mean, you have to understand that enamel is the hardest substance in the human body, and
Yeah.
these people have managed to brush so
Wear
vigorously
through
that
that enamel.
they have like literally scraped off the enamel. We call it abrasion. So
Wow.
they have like scraped off the enamel, and it's been so yeah. the-
Okay. one of the things which do you think that the cosmetic aspect of dentistry is now gaining favor over the relative health? Because in the sense that earlier it used to be that only for teeth which were protruding people wore braces, but now
Hmm.
it's almost like it's become the better your teeth are, the more it means that you're from, that you have invested the money required to ensure you're good. And so, do you see that kind of a change?
No, so to be okay, when we talk about the cosmetic side of dentistry, okay, that's a totally different segment. As far as the alignment of teeth is concerned, uh,
Okay,
we unless and until it's a very minor case of crowding meaning the teeth is little rotated here and there, but then
okay,
the majority of your tooth structure is in place. We call it a class 1 malocclusion. So unless and until that that's kind of okay. I mean, that's people, we don't recommend any treatment for, I mean, any braces treatment for them. But when you look at other conditions, we do recommend braces treatment, not for the aesthetic part alone. We'll have to understand here that by having a good set of teeth, it doesn't necessarily mean your facial profile alone changes. So having a bad
right,
set of, see, if your teeth is crooked and if there is too much of malalignment, then automatically it creates an area where food particles can get entrapped, and when that happens, automatically the bacteria starts acting on the food. It becomes a little difficult for that individual to brush in those areas, and in due course of time they are going to lose their teeth. That is one problem. And the second problem is that they can have a problem with their temporomandibular joint, this joint, the
okay,
jaw joint. So temporomandibular joint, at a later date they may have a problem. So maybe after, once they are like 40s, in their 30s or 40s, third decade or fourth decade of their life, they can develop some issues with the temporomandibular joint, some clicking sound, popping sound, which we have seen some individuals with such issues, and that is because of malalignment of teeth. So gone are those days where you just think about you attribute proper alignment of teeth to being a cosmetic feature. It's not just a cosmetic feature; it's a functional necessity as well.
feature. Absolutely.
Yeah,
Because it's not like you said, it's very important that the teeth align not just for cosmetic reasons, but because of so many other issues that can, you
that is exactly, that is the kind
result.
of, that is the awareness which we are trying to create through our foundation.
Okay,
We're telling people, listen, this is not something which you're doing for cosmetic reasons alone, but you have to understand that there are a lot of things to your oral health as well. Yeah.
okay, okay. Uh, has any patient surprised you? Have you come across a patient who, do you remember patients who came with a condition or came, the way they were managing things was one, I think you've already spoken about, the person who says that he brushed for half an hour or whatever it is every morning. But you have these strange cases as well, I'm sure.
Surprises. I mean, we are trained to not get surprised, so I don't know. Mm.
Okay, okay. What are the ways in which, like you said, one of the problems that is happening now is that people are reading up and they've diagnosed it and come and say, I need a root canal or I need this, or it's almost as if they've arrived at a conclusion.
Yeah.
But as people grow older, what are the things that they have to be more cognizant of? What are the things that they have to keep in mind?
You're talking about geriatric part of dentistry?
Yeah, geriatric, and I think over a time there is a certain thing where you can't say looking after is something that I'll do for 6 months and then forget all about it. It's like a routine that you build. So
It's
let's
very
say
simple.
people have not done, paid too much attention in the early part of their lives. Let's say up to
Hmm.
the age of 40, 45, they've not really done too much. And then they begin to develop problems. So how can they
Mhm.
ensure that at least what they've got, they retain? Or or are you saying that this is a process where once it begins, it kind of the only way is to replace teeth?
I mean, that's too generalized, because again, when we look
Okay.
at the kind of problems that a person has, I mean, if they go to as I said, if they go to a dentist because they've got bleeding gums in their 40s, probably that is a case of periodontitis, and we'll have to see
Okay.
how much of bone level is remaining. And I mean, a lot of things need to be taken into account. But generally, what I also tell my patients is, now that this is catching up, as in preventive dentistry is slowly catching up, the first appointment with your dentist right now, I mean, if you have not been to a dentist in the last 10, 15 years, or never in your life, the first appointment is always going to be really expensive, because we'll have to holistically correct everything in your in the patient's mouth. We'll have to take a I mean, it's just not about addressing the patient's complaint alone. I mean, if the patient says, I've got complaint in the lower left back tooth region, I mean, we don't just address that complaint alone. We'll have to tell the patient that these are the problems that you have, and if you don't get it corrected, then these are the complications that can happen, and that, I mean, it'll further cause a lot of hindrance to their day-to-day activities as well. So the first appointment is always going to be a little expensive in terms of their, because we'll have to completely take care of their oral health, and post that it is just the maintenance phase. Like
Okay.
in our foundation, we say it's curative and rehabilitative. So we have the apex of our focus as preventive, but then the curative and rehabilitative part of dentistry forms the base. So once the rehabilitative and the curative treatments are done, we put the patient back on a preventive focus, where just getting the scaling once every 6 months and making sure that whatever work we have done is intact is more than sufficient to maintain the longevity of the work that we have done also.
Okay.
Yeah.
And the changes in dentistry, I think we briefly spoke about it yesterday when I touched upon where you used to have braces have now been, at least to some extent, replaced by the Invisalign, which is more cosmetic or the thing. So, what is your take on the old versus the new ways of correcting the alignment of teeth?
I mean, there is always a technological advancement. I mean, what the cars which we were driving 20 years ago is not the car that we have today. So automatically,
It's a nice way to put it. Yeah.
any field is going to have its own technological advancement, and probably in the future, aligners maybe, I mean, I don't know, maybe the norm of the day. So it can happen. So any, I mean, we'll have to upgrade ourselves to that particular science. So
Right.
there are a lot of things. I mean, that's happening nowadays. You have crowns which can be delivered within like an hour or two. You get the prep
Okay.
done. You have a CAD/CAM machine in the clinic. You can just immediately get the crown printed or milled and delivered to the patient. A lot of advancements are happening. I mean, even robotics have gotten into dentistry. So yeah, I mean, a
Okay.
lot of things are happening.
So obviously, there's a lot to look forward to. As far as the doctor goes, there's lots of ways in which this will improve. But I noticed one of the things, at least it used to be a problem some years ago, but in terms of matching the color of the teeth, though you think that it's all just one shade of white or beige, getting that exact fit into the mouth where that one particular tooth doesn't stick out like a sore thumb. Is it still an issue, or do you think it's been solved for now?
No, it's quite. So it depends on the kind of restoration that a person is going or getting. Like say, if you look at a metal ceramic restoration, metal ceramic is something where you have a metal component inside and a ceramic coating or a component on the outside. So it looks
Okay.
like, and it doesn't have the basically it doesn't show out the metal component. So you
Okay.
hide the metal component with a, so that has issues with translucency. I mean, it's the metal component is opaque. So when light passes through it, obviously it's not going to look like natural tooth. We have crowns which can mimic natural tooth. If we have something called Emax, zirconia, there are a lot of crowns which can mimic natural tooth. And though we are not having any issues with them, they're slightly expensive, slightly. I mean, and we also have shade guides which help us determine what kind of tooth shade that the patient needs, and that's not a problem anymore, is what I feel.
Okay. Okay.
Mhm.
So, um, people who are entering the profession, what were your early years like, and what do you think have changed? So, what would you tell people who are looking at getting into dentistry about what they should expect? I think you already touched upon that, saying they have to be patient. There is a certain amount of learning. But apart
Yeah,
from that, are there any specifics that your experience can help them with?
we are a country of a population of about 140 crores, and we have a lot of mouths to deal with. I think people have to just be, just keep be a little patient, and make sure that I mean they will get their dentistry is a fantastic field. I mean it's a very good field, of course, and all we have to do is stay a little patient, hope that it will change for initially it might be a little difficult, but then as days grow, as we gain more experience, automatically things will change. Yeah.
Okay. Is there some part of dentistry which you hope could be better in sense of uh, you think where advances need to be there? Do you think that there are certain areas which are lacking at the moment? What are the areas that you hope will develop?
um, so I want. I mean, in my opinion, I would say the basics of dentistry, as far as the uh, awareness part of it is concerned. I mean, when you look at it, we have to educate people on when to go to a dentist. Basically, that's something. I mean, you wouldn't go to a dentist with your with obstructive sleep apnea, but a trained dentist in obstructive sleep apnea can cater to your needs as well. And
Oh,
I think yesterday I
okay.
was reading an article on. I was just skimming through an article where there were correlations mentioned between oral health and eyesight as well, eye related infections as well. So there are a lot of things. It's an interplay. I mean, we'll have to understand that it's a growing field. It's definitely a lot of things are being uh, researched upon, but and we'll have to focus on the basics. I mean, as far as India is concerned, I think we'll have to focus on the basics about getting, or rather, people getting people understand how and why and what to do with their what to do about their oral health.
Hmm.
Yeah.
So, should this be happening more in schools rather than, because at that point, I think is when children are most impressionable, or they need to be taught how to do it early on, because that is a habit which will then continue for life. It's not as if they have to, uh, you know, adults, I think it's much harder to change habits because they're so.
No,
But,
we conduct school programs as well through the foundation. We
okay.
go conduct screening programs for schools. We conduct screening program. I mean, we conduct programs with parents and teachers also, and we have a separate program for it's called Deciduous Smile for Children and Project Smile for Adults, where
Okay.
we find that when we educate the child about oral health, what happens is they go back home and they start asking their parents about it.
Okay.
So we have had cases. I mean, we have had some patients who come to me and they've told me, so they have told the kid. I believe they somebody else had conducted a
Right.
dental camp in their child's school, and they've come back. The child has come back to the parent, and he, I believe, had told the parent that they should brush twice a day, and the father was taking it a
Okay.
little easy, not brushing at night, and
Okay.
he was questioned by the child. So it definitely has a kind of a rub off effect, and
Yeah.
it has to be. I mean, we have to start talking to the children. I mean, they are at the grassroots level right now, and it can, if we are able to bring about a change in the way they think about oral health, then automatically the future generations will also have a better oral hygiene, and they'll be able to appreciate oral health a lot better.
Okay. Now, in terms of a career, I think professions like medicine, or at least in terms of dentistry, where you very clearly you specialize in one particular field and you learn a lot more
Hmm.
about it. It's the it's a career for the long haul versus some of the professions where you could switch between jobs and still do okay.
Yeah,
But in a sense, this is a lifelong commitment, isn't it?
true, very true. So once
So,
you're,
yeah.
it's, I mean, there
uh,
are avenues where you can get into post dentistry as well,
right.
post medicine, post dentistry. There are people who uh, choose not to be in clinicals, they get into non-clinical part of it, or they even sometimes get
Okay.
into other aspects of even hospital management, so on and so forth. So there are different career options available, but yeah, I mean, I choose to be a clinician.
Okay. Are you interested in teaching dentistry? Is that something that you will explore in future? Do you think that that is one of the things that you would
I
like
haven't
to
given
do?
a thought about it at all. I'm, I think it's
Okay.
still we are in our nascent stages where we have to focus on
Yeah.
the
Yeah.
foundation for now, and maybe in the future, if things do come up, then maybe we can get into teaching as well.
Yeah. Okay. On a day-to-day basis, I know
Hmm.
I'm going to pin you down a little here, saying versus what's a good day and what's a bad day
In
in
psychology, they say
practicing
there's
the
no.
profession.
Sorry.
What is a good day for you as a clinician, and what is a bad day? I know that it can relate to the patients, but is there something that you recall about something that you did which made you feel extra good about it?
So the first time when one of my patients sent me a message saying, Kaushik, my 6 month dental checkup is due. When do I come
Okay.
for a dental appointment? I think that was, I mean, that was the first day I felt, okay, come on, I've made some kind of an impact.
Yeah.
Yeah, so
Okay.
that on such days, I mean, I would definitely classify them as a really good day when patient gets back to you
Okay.
and says, my 6 month dental checkup was due, and
Right.
when I don't have to follow up with the patient regarding their dental checkup, then I'm really happy about it.
Okay.
Mm.
And is there a certain what do you say procedure you do which you approach with more gusto than you would something else? Is there, or is it something that the reason I'm saying this is that in every job, it's not that you like every aspect of your job. There are
Hmm.
parts of it you like, and there are parts you don't like.
Hmm.
So, is there something that gives you more pleasure or tells you that, hey, this is something that, or it calls for an extra bit of skill? So, or I'm asking you to do that because I'm saying maybe you don't consciously look for it. But now that I've
Yeah,
asked you the question, is there something that,
see, every single time even if the patient is known to us, every single time we start any procedure, it's a new. We'll have to do it with a lot of caution, because if we
right?
take it a little too lightly, we may slip up. And that is the first thing that they teach you. I mean, to approach every single procedure as if you were doing it for the first time. I
Okay.
mean, you may be very well skilled in that particular procedure, but then still, it's better to hold on to your horses and say, okay, fine, let me take it a little slow. So, I mean, I don't think there's a procedure where I have a lot of gusto, or I mean, I don't think so. I just take it one procedure at a time. So, yeah.
Okay. So obviously, this is one of those layperson questions where we don't understand the mindset of doctors, and I think some of these
It's very
things you have to be steeped in it. You're very
it's
right
different.
because
It's very different.
uh, yeah.
A person's pain tolerance, a person's it depends. We've had patients who are they have fear of needles, and treating them with a certain degree of caution is also required. We've had patients, they'll all be okay, they'll all be all macho, and all of a sudden they enter into something called a syncope, which usually happens, like I mean, it happens with people who they become I mean, they develop anxiety, and they kind of faint. So all those things do
Oh,
happen. It's just that we have to be equipped to handle those situations. And if a person is able to take up the procedure as his or her first every single time, then I think I mean, extend the kind of caution that they would while doing it for the first time, then I think all procedures are going to be a smooth breeze.
okay. Wonderful. We've spent almost an hour talking about this, which is so. Thank you for taking us through your career journey, your attitude to dentistry, and how it has changed over the years. The work that you're doing with Total Oral Care, and I hope that it'll grow from strength to strength, because these are the kind of changes which are not seen immediately, or they're not seen, they only manifest over a great deal of time. I mean,
True.
whether classic in Chennai is the Cancer Institute where Dr. Shanta, I think that was almost a lonely battle for about 10, 20 of
Mhm.
those 40, 50 years that she did.
Many
Where,
decades.
but because of that, and like Shankar Netralaya, which you talked about, these are
Mm.
organizations which have brought about tremendous change. So it's great that you've embarked on this early on. So, any closing thoughts, anything that you want to leave the listeners of this podcast with?
I would say, people always complain that the procedures are really expensive, and my especially when people come to me and they say, "Why is it so costly? Why is dental treatment so expensive?" And I tell them, dentistry is never expensive. Dentistry is not expensive, but dental neglect is. If you go to a dentist every 6 months, get your scaling done, all you pay is 1,500 rupees. But then, if you neglect your oral health, then you probably end up spending a bomb on it. So yeah,
Okay.
I say
Yeah.
dentistry.
Fair, because I think that's absolutely true. You can't expect to neglect something and then say that I will not pay whatever is required, because obviously there is a cost involved.
Yeah,
So, thank you for taking the time, and it's wonderful to see how uh, you know uh, you've gone deeper and deeper into the process of medicine. We've obviously not been able to cover a great deal of what you do on a day-to-day basis, but I think it'll give some people, people an idea of what is involved on in following this profession and where it
mm.
takes you from here. So, thank you, Dr. Kaushik, for coming on the program. And it was a pleasure talking to you.
Thank you, sir. Thank you so much. Thank you.
Thank you very much. That was Dr. Kaushik Ramakrishnan. And he told us about what it means to follow a career as a dentist. And obviously, I think that last thing of it, that dentistry is not expensive, but neglect is a wonderful thought to end this program on. So we'll be back next week with another guest, another profession. And thank you again for watching. And it's been a pleasure doing all these episodes with you. Thank you.